There's just not enough people that are going into healthcare or that have stayed in healthcare. I think we learned through the pandemic, there's a fundamental shift in how people start to think about healthcare.
The recruitment and training of new staff has been the most critical barrier for us to serve more patients.
This is true in healthcare, and it's extremely true in the operating room, where the stakes can literally be life and death.
Thank you for joining me today to consider a vital priority for all of us, the workforce crisis in healthcare. The challenge of limited resources is very real. It's becoming harder for healthcare organizations to find and keep qualified staff. Meanwhile, demand for care continues to rise. How can our joint innovations power the capacity and satisfaction of healthcare professionals? Moreover, how can we not only alleviate healthcare workloads, but ultimately increase patients' access to care? We are witnessing extraordinary breakthroughs in medical science, especially in digital, data, and AI. Breakthroughs which technically empower staff while making their jobs more meaningful and productive. We believe new solutions are possible in a world of limited resources. Collectively, our actions can improve the well-being of millions of healthcare workers and the patients they serve. Please join us in co-creating a more sustainable and more equitable future of healthcare. Welcome to Shape 24.
Depending on where you live in any major city or rural area, your life expectancy may vary a number of years. There's an incredible growth in demand, particularly when we're shifting to more complex and higher acuity patients. So I think the biggest struggle is really trying to align our ability to provide the care to the communities that need it. And this is a workforce crisis that is evolving and is going to continue. We have to start thinking about how do we start to rebuild our workforce to meet the growing demand.
Icon Group commenced in Australia and grew really rapidly. Over time, we saw that there was great need in other regions. So mainland China is an area that was identified early on as one where we could partner really well with local hospitals to deliver healthcare, and especially radiation oncology. What we did then was open multiple centres through mainland China very quickly. And what we couldn't do was send staff to every single centre at every moment that they needed them. What we don't want to do is have patients wait for treatment.
In a more and more individualized society, it gets tougher to recruit staff for altruistic jobs. We have night shifts, we have work on the weekend, we have no home office. We have to provide a high expertise of care 24/7. This puts high pressure on our staff, and there's no room for failure. When you come in the morning and on short notice 2 of your best techs are missing, this really is a catastrophe. Everyone tries to compensate. The surgeon deviates his focus from the patient towards the imaging process. If this cannot be managed, the operation might not be performed.
Workers are seeing extra time they need to put in, they need to do more, they're being more stressed, they see a lot of overhead in terms of repetitive work. They see that their job is getting very stressful, right? And yet they don't get to spend a lot of the time to do what they love most with patients. How can we augment the role of healthcare workers so that the high-performing workers find their work even more fulfilling and new workers are available by lowering the experience for them to be truly good? To answer this, we need to look at different healthcare workflows and discover how they can be re-envisioned by using new technology such as artificial intelligence and new talent models. There are 3 factors that should be looked at. First, talent. To what extent can this job be simplified by enriching workers with the right information? Are there new training methods that are more effective in acquiring challenging skill sets? Second, automation. And this one really close to my heart because this is what we work on a lot here in the AI labs in Siemens Healthineers. How much of these tasks can be supported, for example, through digital automation or robotics? for instance, to reduce repetitive mental, physical burden of the job. And third, location. Must this job be performed synchronously at this existing location? Or would an alternative provide an even more flexible yet still connected experience for both patients and workers? Can the patients be empowered to do some tasks more conveniently and according to their preference? The solutions to these questions will help me support health providers in scaling up their capacity and truly manage the workforce shortage successfully.
And the truth is, all of this is already happening. At Siemens Healthineers, we'd like to partner with you on reimagining workflows and creating the workplace of the future. We can support you with our expertise, services, and with our technology today. First, technology that supports talent, allowing professionals of all skill levels to excel at their jobs. Today, AI supports professionals in complex measurements across ultrasound use cases in radiology, cardiology, and electrophysiology imaging. In other diagnostic imaging modalities, the AI-based MyExam Companion provides end-to-end guidance to any professional. Soon, it will also guide them on the new Somatom Pro Pulse, which will make advanced imaging like dual-source cardiac CT accessible to more patients. These technologies can also ease shift planning and staff rotations. To ensure that your team has the skills to successfully work with these technologies, digital tools like virtual classes and on-demand e-learnings can make it easier than ever to develop talent and scale up capacity. Second, technology to automate mundane activities. Robotics can make work more fulfilling and scale up capacity no matter the size of your lab. It can take over tasks like cell counting and fluorescent microscopy, or sorting and decapping sample tubes. Beyond the lab, automation also holds a lot of promise. In early 2024, we will introduce the C-Arctic Move, a mobile C-arm which is designed to be self-driving and to simplify imaging workflows during surgery. And third, technology to overcome location challenges. For example, technology to bring expertise and capacity from outside into your organization. Advanced oncology solutions range from expert advice on increasing patient throughput to contracting remote expertise from treatment planning to quality assurance services. Talent, automation, and location. At Siemens Healthineers, we are addressing these factors to turn today's workforce challenges into opportunities.
So technology can kind of help us correct for expertise. And then a second piece of that is technology can help us scale. I really am very hopeful because by leveraging workforce solutions, the apprenticeship program, and reaching into those vulnerable communities, we start to create a workforce at the hospital level or the ministry level that is really more reflective of our community.
Digital solutions allow us to extend our cancer centres into areas where they need the care we deliver, but did not have the people to deliver it. Today, we can provide radiotherapy treatment plans within 24 hours across our entire network. So, with Siemens and Varian joining forces, all it's done is make it easier for us to automate and enhance our workflows. We've unlocked the capacity of our full network of experts that support each other.
Having an imaging system that can automatically return to predefined positions we've used before could make a tremendous difference for us. This allows the rest of the team to focus on the surgery. Today, everyone looks for purpose in the workplace. And what could have a bigger purpose than to be able to provide a good patient care?